In Washington, President Donald Trump announced his intention to sign an executive order on Monday. This order, if executed, aims to reduce the costs of certain medications, reviving an effort from his first term on a topic he has emphasized since before his presidency. The order will instruct the Department of Health and Human Services to align what Medicare pays for medications administered in a doctor's office with the lowest price paid by other countries. Trump stated on social media, "I will be instituting a most favored nations policy, whereby the United States will pay the same price as the nation that pays the lowest price anywhere in the world." He promised to sign the order at the White House on Monday morning. Trump expressed that this policy would ensure fair treatment for the United States and significantly reduce healthcare costs for citizens. The proposal is expected to impact specific drugs covered by Medicare and administered in a clinical setting, such as infusions for cancer treatment and other injectables. While it could potentially bring substantial savings to the government, the trillions of dollars Trump mentioned might be an overstatement. Medicare provides health insurance to approximately 70 million older Americans. Both political parties have long been critical of high U.S. drug prices, especially when compared to other wealthy nations. But a lasting solution has yet to pass through Congress. The proposed order would tie the federal government's payments to pharmaceutical companies for these drugs to prices paid by a group of other economically advanced countries, following a most favored nation approach. The pharmaceutical industry is expected to strongly oppose this proposal. A similar rule was attempted during Trump's first term, but was not implemented. Although Trump signed an executive order near the end of his presidency, a court order prevented it from taking effect under President Joseph Biden's administration. The pharmaceutical industry argued that Trump's 2020 attempt would allow foreign governments to influence the valuation of medicines in the U.S. They also claimed that forcing lower prices would harm profits and ultimately impact innovation and efforts to develop new medicines. The plan is likely to cover only drugs under Medicare Part B, which includes insurance for doctors' office visits. Medicare beneficiaries bear some of the costs for these medications during visits, and traditional Medicare enrollees do not have an annual out-of-pocket cap on their payments. A report from Trump's first term found that the U.S. spends twice as much as some other countries on these drugs, with Medicare Part B drug spending reaching over $33 billion in 2021. More common prescription drugs obtained from pharmacies are probably not included in the new order. Trump's announcement came after he hinted at a very big announcement last week, noting that it was unrelated to trade or tariffs. During his first term, he accused pharmaceutical companies of exploiting Americans and criticized other countries for taking advantage of U.S. drug prices. On Sunday, Trump criticized the industry again, stating that pharmaceutical companies justified high prices by citing research and development costs, which were unfairly borne by Americans alone. He also commented on the influence of campaign contributions from drug companies, but emphasized that they would not sway him or the Republican Party. Trump assured that his administration would take appropriate action to address this issue.